right, Miigwech, merci beaucoup. Thank you for joining us this evening for our Health Sciences webinar. I appreciate that some people are going to filter in over the next few minutes, but just to keep us on track, we'll get started. So again, thank you for joining us this evening for our webinar entitled Jamel Coeur, How Francophones Are Falling Through the Cracks of the Healthcare System, and what Health Sciences Clinicians can do about it. Our webinar this evening will be delivered by Dr. Meghan Cusack and Mr. Patrick Timony. I'm Dr. Michael Ravnick, the manager of the Health Sciences programs at NOSM. And before we get started this evening, I'm just going to do some quick welcomes and introductions. And in terms of our agenda for this evening, a typical agenda for our webinars, after the introductions, we will move into the actual presentation and then have some time dedicated at the end for questions and answers. Now, our presenters tonight certainly said that if you wanted, you could put your questions into the chat as well throughout the presentation. So you can do that, or you can wait until the end and put your questions into the chat box. And certainly your questions can be in Anglais or Francais, depending on your preference. This is also a reminder about the camera and microphone, so please do keep those off during the webinar. This webinar is being recorded and is going to be posted to YouTube within 2 to 3 weeks. Our first 3 webinars are now on YouTube already, and you can find those links to those recordings on our Rehabilitation Sciences and Dietetics websites. So we'll start with the land acknowledgement. So we acknowledge that the entirety of NOSM's wider campus of Northern Ontario is the ancestral traditional lands of the First Nations people and Métis people who resided alongside. We also respectfully acknowledge that the medical school building at Laurentian University is located in the Robinson-Huron Treaty Territory, and that Lakehead University in the Robinson-Superior Treaty Territory. So our first speaker this evening is Dr. Meghan Cusack, who is a native of Sudbury, having left town only to complete her post-secondary and medical education in French at the University of Ottawa. She returned to Sudbury to complete her family medicine residency with NOSM and has been providing bilingual care to her patients since 2010. Her work with students led her to appreciate the need for increased linguistic sensitivity training at NOSM, and she became the undergraduate Francophone clinical lead. She continues to work with Francophone and Anglophone students to improve their Francophone cultural competency in an ongoing effort to improve access to care and cultural safety for all patients. And Patrick Timony is a research associate at the Center for Rural and Northern Health Research, as well as a PhD candidate with the School of Rural and Northern Health at Laurentian University. His research interests include studying the distribution and practice characteristics of healthcare providers in Ontario, with a particular interest in linguistic competence and the active offer of French language services, and how linguistic concordances and discordances between healthcare providers and patients can influence care delivery, patient satisfaction, and patient health outcomes. Patrick is also the Northern Coordinator of ARC, or the Access to Resources in the Community, a collaborative study between researchers in Sudbury and Ottawa that examined the benefits of patient navigators in helping patients access community-based health-enabling resources. Miigwech, thank you. Merci beaucoup, Meghan and Patrick, for your time today. And I'm now going to stop sharing my screen and turn things over to the both of you.
So hello, everyone, and welcome. So as Mike said, my name is Dr. Meghan Cusack. I'm a family physician here in Sudbury. We've been, Patrick and I have been coming up with this program in some way, shape, or form for several years now. We started off by making this presentation to the medical students And all of this really started with the fact that I had medical students at the beginning of my career, and they were coming to work with me, and I would explain, okay, the next patient up is Madame Manita Tranche-Montagne, whatever. And the students would say, oh, do I have to speak French? And I'd say, well, you're a Francophone student. Yes, of course you should. That's, patient-centered care. And they just really didn't feel ready. They didn't feel prepared. They didn't feel that they had the tools to provide any kind of culturally sensitive care. So with that in mind, when you see a problem, you got to change it. So that's when I took on the role of clinical Francophone lead at NOSM, and we've started our endeavors to improve the situation. Now, one of the things that I hear the most frequently from my Anglophone colleagues is, why are we even doing this? Is this really necessary? For the most part, Francophones in Northern Ontario are bilingual, and there's not really a need for this. There's not really a problem, and I don't know what you're talking about. To which I say, interesting. One of the quotes that I've heard the most from my Francophone patients is, I can live in English, but I heard in French. And when you are at your most vulnerable, when you need care, when there is a major power differential, it is just easier, more comfortable, and safer to provide that care with cultural sensitivity in mind. So I welcome you, if you're still struggling to understand what it must feel like, I welcome you to imagine this. Imagine you're off on vacation. Unfortunately, with COVID, none of us are traveling much, but we can pretend. And let's say you're off in Italy, you're enjoying a lovely vacation. You've known the basics. You've got your Frommer's book ready to go. And so you know how to ask for the washroom and possibly ask for, a beautiful glass of wine. But that's kind of the limits. And lo and behold, you get hurt, you get sick, and you end up in the hospital. And you know how to get by. You know some of the words. But wouldn't it be lovely if somebody came up to you and said, "Ma'am, sir, I speak English. Can I help you today?" That feeling of comfort, that feeling of safety, that feeling of, oh, thank God, I don't have to struggle and make an already challenging situation that much more difficult. That is what we are talking about today, and that is why we have come up with this session. So on that note, I'm going to laisser la parole, to leave the next page off to my colleague Patrick. He's going to go through some of the research that backs up our presentation, and then I'm going to come back at the end to finish up and go through some of the strategies that we've been able to pull together to assist caregivers and healthcare professionals to provide more culturally sensitive and safe care to our patients. If you have any suggestions or questions, we do ask that you throw them into the chat if there is a pause, and we can add that to our conversation, make it richer. We would love to be able to do that. So please join the conversation. Pat, I leave it to you.
Merci, Megan. So I'm just going to now share my screen, and hopefully you can see what I see. So yes, we're going to actually, when we do these sort of presentations, when we do these sort of activities in person, we like to have it interactive. We like to talk to people and get the reaction from the crowd. We can't do that today, but what we can do is give you a survey. And these are questions that are live. So if anyone would like to either take with your smartphone and use this QR code or enter the address to the left, that'll allow you to answer some of those questions. And I actually have the first question. So if you can go on to it, it will bring us to our first few questions. And the first one was, do you offer French language services in French in your practice? And I'll actually go back to the other screen just to make sure everyone has a chance to use the QR code and enter that link. And during that time, I just want to tell everyone that, yes, I am a research associate with the Center for Rural and Northern Health Research, and I've been conducting research on Francophone health for about 10 years now. So a lot of what I'm presenting is the result of the research that I've been doing. So let's go see what the responses are looking at. And about 75%, now there's been 4 votes, but 75% of you, 60% say that you do offer services in French, 40% say that they do not. So we'll now get to the next question that we had for you. So what percentage of your patients speak French? So 0 to 10, 11 to 20, 21 to 30, etc. And obviously this will depend on the community that you work at. So now almost everyone's voted. Some people saying 0 to 10, some people 11 to 20. I would be interested in speaking to the people who are saying less than 20% to find out where you're working and what environment. And the reason that I say that is because, whoops, if we take a look at, no, we've gone through these slides. If we take a look at our map of Ontario, we see that about 4.5% of the population of Ontario speaks French, but in Northeastern Ontario, it's 22.6%. And now I know some of you are not, everyone here is not in Northeastern Ontario. People I'm sure are joining from across the north. So it'd be interesting to find out what is the Francophone population of the community that you are working in. But if you are working in Northeast, it's probably going to be around that 20%, and some communities is a lot higher. If we take a look at the map on the left, a few definitions that I want to go over to start with. The blue portion of the map is what we consider to be Northern Ontario. The green portion is the South. When we're talking about urban communities, we're talking about communities that have a population of 10,000 people or more. Those are the checkerboard patterns. And then we've created this degree of Francophony. So strong French communities are communities where at least 25% of the population speaks French. Those are the dark blue and dark green areas. Moderate French communities between 10 and 24.9% of the population speaks French. And weak or no French communities, those are communities where less than 10% of the population speaks French. So the really light green and light blue areas. So it's very obvious looking at the map that Northeastern Ontario is where we find those large French populations. Another thing that's important to know when we look at the Francophone population in Ontario is it's actually growing. It's been growing steadily since 1986. However, it's not growing at the same rate as the rest of the population. So the proportion, the percentage of Francophones in Ontario is actually getting smaller. This is what makes it a challenge to actually serve Francophones, because although there's more of them, it's harder to identify them. There's likely fewer of them within our communities because they are not growing at the same rate as the rest of the population. That doesn't mean that they should be ignored, however. So when we're talking about Francophones, what we're really talking about is the importance of communication. And in the literature, there are a number of studies that'll tell us the benefits of good communication and the risks to poor communication. So good communication leads to a better understanding of medical information. Patients are better able to cope with their diseases. There is a higher quality of care. There are better health outcomes. There is a better sense of well-being, a better medication adherence rate, and a better patient return rate. However, when there is poor communication, this is often a barrier to health education. And it's also linked to lower comprehension and compliance with recommendations. Obviously, if we don't understand what we're being asked to do, the patient doesn't follow recommendations. There is a higher adverse medication reaction. There is higher hospital admission and readmission. There is higher rate of prescribed medication. There is a lower rate of optimal pain medication, and patients are less adequate at managing their own chronic diseases. So there are a number of benefits to good communication and risks to poor communication. And there are certain groups that are particularly at risk. These are children, the elderly, recent immigrants, and people in a crisis situation. Now, what all of these groups have in common is their ability to communicate is often hampered one way or another. Children lack a vocabulary to properly express what they're feeling. An older Francophone population might regress and not be able to speak the English language if they first learned French. Many immigrants will not have English at their first language, so they'll have that communication barrier. And obviously, if you're in a crisis situation, particularly if you're unconscious, there is no communication at all. So we'll now go to the third survey question that I had for you, which is, in your opinion, which of the following statements with an S, so there's more than one possibility, which are false? So when compared to the general population, do you believe that Francophones tend to be older, less educated, more likely to be living in poverty, more likely to live in a rural area, more likely to suffer from multiple chronic conditions, more likely to smoke, more likely to consume alcohol, or more likely to be overweight? And so far, it's equal all the way down the board, and it's not getting any different. So living in poverty so far is coming out ahead, obviously by one vote because of the number of people we have. But so it looks like living in poverty, everyone else thinks that the rest are probably false one way or another. So let's look at the answer to this question. So based on research and statistics from Stats Canada, the two statements that were false is that they are less educated and they are less likely to be living in poverty. The education piece, according to Stats Canada, there is a larger percentage of Francophones that have a post-secondary education than the general population. So it's 68.1% versus 65.2%. Now that's important because a lot of the other health concerns that we have in this list, like the multiple chronic conditions and the poor health habits like smoking and consuming alcohol, it's not because Francophones are less intelligent. It's not because Francophones are less educated that they have these poor health outcomes. Oftentimes it's because the messages are not equal in French as they are in English. Health-related messages are more frequent in English and they're more clear when they're in English. It's a lot harder to come by health information in French, and that might be one of the reasons that we're seeing this. The other one that's false is the living in poverty. And this is actually just recently false. So in 2016, it is the first time in the history of Statistics Canada that Francophones were less likely to have an annual income that's lower than $20,000 per year. So at 32.2% versus 35.4% for the general population. And what's interesting is every income stratification after that, there's actually more Francophones than Anglophones. So they are actually slightly more wealthy than the general population. So now to get to a few of the research or some of the research that I've worked on. And I'm framing this under the theme for tonight, which is the cracks, where Francophones are falling through the cracks. So the first crack that I want to talk about is access to French language services. In a report by the Fédération des communautés francophones et acadiennes du Canada, it was stated that access to healthcare services in French for Franco-Ontarians is severely lacking in hospital services, community health centers, medical clinics, and home care, and that these four sectors cover most healthcare services available in Ontario. Now, obviously, that's not all healthcare services, but that's a very big portion of them. And although this is a report from 2005, unfortunately, not a lot has changed in the last 15 years. So some of the research that I wanted to look at initially and still working on is trying to find out where are French-speaking providers located. Now, in 2013, I had data on physicians. I'm currently working with data on pharmacists, but I'm sure a lot of what we're presenting today is going to equally be true for all healthcare providers. And what I was interested in knowing is where are they located? Where is the geographic distribution of these healthcare providers? And I created ratios of French-speaking providers per 1,000 Francophone in order to be able to compare rural communities to urban communities on an equal playing field. So what we found is that there's actually 15% of physicians who said that they were able to practice in French. And 7.5% of pharmacists said they could practice in French, which is really not bad when we consider that less than 5% of the population of Ontario is Francophone. So we would think that that 15% of physicians and 7.5% of pharmacists should be able to offer services or should be able to take care of that 5% of the population. However, what we found when we looked at the geographic distribution is the vast majority of both physicians and pharmacists were located in urban communities in Southern Ontario, and that the availability was much smaller in in Northern Ontario, regardless if it's rural or urban. There's less availability in the north than there is in the urban south. Now that sounds pretty obvious. I'm sure everyone could have guessed that. The other thing we found is that as a community becomes more Francophone, there's actually less availability of both physicians and pharmacists. So in those strong French communities, those communities where 25% of the population speaks French, the availability was sometimes 3, 4, or 5 times smaller than in the weak French communities, the communities where there are fewer Francophones. So what we concluded is that there was a maldistribution of French-speaking providers. Those who can speak French are not necessarily practicing in the communities where the need is the greatest. The next crack that I want to talk about is the workload of French-speaking providers. Now, although this was done with physicians, I'm sure you've all heard the same sort of anecdotal story where if you are a French-speaking provider, you will be in high demand. And that is exactly what we found when we looked at the data. French-speaking physicians who practice in strong French communities had a heavier workload in terms of hours worked and patients they see per week. And what this turned out to equal to is if you are a French or if there was a French-speaking provider in a strong French community in Northern Ontario, they worked 5 hours more per week and saw 20 more patients per week, which is pretty much the equivalent of an extra day's worth of work that they were doing that the average physician wasn't doing. And again, although this is physician data, anecdotally, we hear the same story regardless of the health profession that we talk to. If you speak French, you are in high demand. And that's important or interesting because the higher demand, the heavier the workload, the more likely it is that these very important French-speaking providers are going to burn out and not be able to continue caring for that patient population. The next crack that we want to talk about is barriers to serving Francophone patients. And this was, we found these barriers by conducting interviews with French-speaking providers. And the first barrier that they discussed was obviously if you do not speak French, language barriers are going to exist. Language discordance is going to be a barrier. That's not necessarily a problem. What is important is to acknowledge that there is a language barrier and to try and find ways to overcome that language barrier. We don't just ignore it when we know that there is a language barrier. We try and find ways to overcome our strategies that can help overcome our barriers. The next one is the characteristics of Francophone patients. So a lot of those characteristics that we saw earlier, the fact that they're older, the fact that they have unhealthy health habits like smoking and drinking, the fact that they have more chronic conditions, providers were recognizing this in their patients. And they were, not only were they recognizing it, but they were saying that that makes it that this Francophone population is a more difficult population to serve because they have these extra needs. They also identified the dominance of English in medicine. If you were educated in English, if all of the documents that you receive are in English, if every time you speak to a colleague, it's in English, it perpetuates this notion that medicine, that healthcare is an English profession. And it makes it very difficult for that healthcare provider to then speak in French with their French patients because they're so used to it, so ingrained in them that healthcare is English. But that's exactly what we're hoping that you will do, is to sort of break that cycle and speak in French with French patients when it's possible. And you'll notice the more you start doing that, even if it's just a few words here and there, the more it'll be easy, the easier it'll get, and the more it'll seem natural. The next barrier was the lack of French-speaking medical personnel, and this is at all levels, whether it's a French-speaking provider or French staff, French reception. It's very difficult to find French personnel, and if you are lucky enough to find them, hold on to them, because what we heard from a lot of people is that if we do have a French-speaking provider, they're in such high demand throughout the province that we just can't compete with the large urban communities that can offer better benefits, they can offer better salary, and we end up losing them. So if you're lucky enough to have good French staff, try and hold on to them. And then the final barrier is something that we coined linguistic insensitivities. What I mean by that is that when we spoke to French-speaking providers, they told us things like, you know, I know my patients well enough to know who wants French and who wants English. I don't really need to ask them. That might be true, but the problem is this is based on an assumption. And what often might happen is you might have a French patient who would really prefer services in French, but the patient never asked for them in French, and the provider never offered it in French, so the provider continues to offer services in French or in English, and the patient is just continually dissatisfied with that service. And it's this vicious cycle that we see happening time and time again, where the patients don't demand the service, because there's no demand, the providers don't offer the service, and what ends up happening is not only are the patients less satisfied, but they end up having all those negative health outcomes that, or those risks that we saw earlier that are associated with poor communication. There is a gap in communication, even though the patient is not expressing it, and that could have some negative impacts on their health. The next track that I want to talk about is the Francophone patient experience. And for this, we conducted interviews and focus groups with French patients who either had a French-speaking provider or an English-speaking provider. Now, again, here, we were talking about French-speaking physicians and non-French-speaking physicians, and we asked the patients to simply describe their experience with a visit to their physician's office. And what we found is that when the patient had a French-speaking physician, the experience was much more positive. They said that they felt comfortable. They felt like the service was more accessible, like they were safer, and like they were better able to take care of themselves. However, when they had a non-French speaking physician, it was the same emotions, but they were experienced a lot more negatively. Patients felt like they were uncomfortable or discomfort. They felt like the service was less accessible. They did not feel safe, and they did not feel like when they left the office that they could really take care of themselves. They didn't know what to do next, or they didn't feel capable. And you'll notice this little heart at the middle. These are how those 4 different emotions were expressed. Now, we also asked them to identify all of the critical moments that characterize a visit to their physician's office. Now, this is a physician's office, but the same critical moments happen regardless of the healthcare service that they're receiving. It could be going to a dentist's office. It could be any healthcare service that they are receiving. It all begins before the appointment ever happens, when they're preparing for the appointment. And you'd be surprised how stressful that preparation period can be for patients, for Francophone patients. Oftentimes, they'll write out all of their questions in French, and then they'll go and they'll have them all translated. And then they're so concerned that they're going to forget something, that they won't be able to ask the question properly. It is a very stressful period leading up to the appointment. Then they get to whatever healthcare facility that they're going to, and they're greeted. There's a welcome. If they're not greeted in French, they don't feel like they really belong there. They don't feel like they were greeted at all. They're then going to be sitting in a waiting room. And if everything around them is in English, again, they just don't feel like this is a place for them. They might receive some sort of care from another healthcare provider or from a support staff. If everything they receive isn't in French, again, those emotions come out, those negative emotions come out. They might wait in an examination room, and then there's this cyclical process where they're seeing the healthcare provider, the reason that they're there. And this will have things like explaining the reason for their visit, just having a general discussion about their health. They might receive test results or a diagnosis. They might ask questions. They're going to try and understand what the healthcare professional is telling them. And then it'll end with some sort of treatment or some sort of care. And this is a cyclical process, and it doesn't always happen in that order. But what's important to note is that all of those negative emotions are there if there is no offer of French language services. You just do not feel comfortable the whole time that the patient is there. Now, that was sort of a qualitative study that showed us that. We also did a sort of quantitative study where we had patient satisfaction surveys. And what we found is that Francophone patients who said that they prefer to receive services in French, that blue bar, and regularly receive services in French, were statistically more satisfied with their care, or sorry, significantly more satisfied with their care than those who prefer French and rarely or never speak in French with their healthcare professional. What's interesting here, or what's important to note, is that English, if a French patient prefers English, they were equally satisfied regardless of whether they were regularly receiving French language services or not. So what that means is if you're offering French services, it's not going to hurt those who prefer English, but it'll be so beneficial for those who prefer French and who can receive that service in French. So the final gap that I want to talk about is, and I've alluded to it throughout, it's this gap in beliefs. Throughout all of this research that we've conducted, we've noticed time and time again that the patients will tell us things like, je suis beaucoup plus à l'aise si je peux m'exprimer en anglais, excuse-moi, si je peux m'exprimer en français, même si je parle un assez bon anglais. So I'm much more comfortable if I can speak in French, even though I do speak English. And providers were telling us things like, people are so bilingual that it makes no sense for me to speak in French. And what we noticed is there was this lack of communication between the patient and the provider. And this is that vicious cycle that I was talking to earlier. The patient might prefer French, but they never ask for services in French. There's never a demand for services in French. So the provider never offers the service in French, and it just keeps going where the patient becomes less and less satisfied, and the provider doesn't notice that there's actually a problem with the patient. And so it's vitally important to have that conversation. So what are some things we can do to bridge that gap? First, I want to ask you 2 more questions in our survey. So the first question is, would you consider yourselves competent enough to conduct your practice in French? So with the first few votes, it's 4-3. 4 people are saying that no, they do not consider themselves competent. No, it's 50-50. So half of you are saying yes, half of you are saying no. And this question of competence is an interesting one because you might not feel competent to practice in French, but your French patients also do not feel competent receiving services in English. So if you're sitting in a room with a patient, the person who should be feeling the most comfortable, this person that you should be trying to make feel at ease is the patient. Even if you don't feel comfortable speaking in English, it's more important that the patient feels comfortable than you feel comfortable at certain times. So the next question that I wanted to ask you, is, now that was competent. Now, who here can speak any level of French at all, or French to any degree, even if it's just understanding it or a few words? With 4 or 5 votes, we're still at 106. So 87%, there's it seems like one of you that say no, you cannot speak French. But for those of you who can speak French, that is great. That's already a great start. It only starts with a few words. You'll be surprised how comfortable you can make your patient feel if you use just a few words in French. So talking about some strategies. Now, how can we bridge that gap? The first strategy is, well, we can train future French-speaking providers, and that's exactly what NOSM is trying to do. NOSM is trying, through their social accountability mandate, to recruit French students, give them an opportunity to train a little bit in French, and then hopefully have future French language providers. The problem with this is it's a long-term strategy. It could take a number of years before we actually improve French language services in Northern Ontario. The second strategy that I will suggest is targeted recruitment and retention. This is often done through incentives, where we'll provide some sort of financial incentive for French-speaking providers to go to high-needs communities. The problem is incentives are often really good at recruiting. They're not so good at retaining providers. And this usually leads to a revolving door phenomenon where the provider comes and then as soon as the incentive runs out, they leave and then we have to start all over again. This is really a medium-term solution. We might get someone in the short term, but they're not going to stay forever. The third strategy is equipping current providers with the tools to better serve their Francophone patients. And that's exactly what we're doing tonight. The idea by having sessions like these is to try and get people who are already in Northern Ontario, who are already working in these strong French communities, give them the tools they need to better serve their patients. And that'll provide the patients with a strategy that could immediately improve their care tomorrow. And probably the most important tool for this strategy, the most important tool for your toolbox is the active offer of French language services. Now, the active offer is the action of proactively offering French language services, which are always available. So it's not just a few times in the week or only when someone's here. It should be always available. It should be clearly communicated. So you should be verbalizing that we offer services in French. It should be visible. There should be signage showing that services are in French. It should be easy to access. And it should be of equivalent quality to the services being offered in English. Now, I'm presenting it very briefly today because I know in the new year, you're going to have a session from Le Réseau du Mieux-être all on active offer. So this is a very important tool. They're going to provide a lot more detailed information. I'm just giving you a very brief overview. Now, when it comes to active offer, what are some of the responsibilities of healthcare professionals? What are your responsibilities? Well, first, it is your responsibility to make sure that the Francophone client is being proactively welcomed in French. And this is vitally important that the first point of contact happens in French. It sets the scene for the rest of the healthcare experience. If the patient is greeted in French, they right away feel more comfortable and they feel comfortable speaking to you in French and saying, yes, this is I would prefer to have services in French. It's also your responsibility to understand the needs of your Francophone clients. And you can't understand the needs of your clients without asking them. You have to have that conversation. What are your language preferences? What are your language needs? How can I best help you? We can't ignore this very important part of getting to know your patients is asking them what are their communication preferences and needs. And then you can have a frank conversation about, hey, I might not be able to speak French, or here's where my limitations are, but we'll work together to give you as much as I can services in the language that you prefer. It is also your responsibility to provide the client with the necessary care they need, or to refer them to a resource able to provide that care. So if you really can't take care of a patient, if you really can't speak and understand the patient, then there's no shame in referring them to someone who can. That might be better off for the patient. It is your responsibility to take on a leadership role by promoting the active offer. And I know this is a lot easier when you're in a management position, but it's not all management positions that will notice the importance of active offer and the importance of communication and French language services. What we need is champions that will stand up and say, no, this is important. I'm going to do it. And I strongly recommend that we all do it. And then finally, it is your responsibility to ensure that ensure quality of care for and the safety of the people that you serve. Now, it's important to note that none of these responsibilities are for French providers. These are all things that anyone can do. Now, the last thing that I want to leave you on is that same patient satisfaction survey that I talked about earlier. We also had questions about the active offer. And we were able to create an active offer score and create a correlation between patient satisfaction and active offer. Well, we found that for Anglophone patients, there was absolutely no correlation. So regardless of whether or not there's an active offer, they're not more or less satisfied, which is really good news. By actively offering services in French, it's not going to harm your Anglophone patients. However, Francophone patients, there was a strong positive and statistically significant correlation between active offer and satisfaction, such that the more a patient recognizes that they're receiving services in French, the more satisfied they are with their care. Not only that, but a multiple regression revealed that the active offer scores were a significant predictor of satisfaction, and that they could explain 23% of the variance in patient satisfaction. Now, what that means for you is if you want to improve the satisfaction of your Francophone patients, an easy way to do that is through the active offer of French language services. And with that, I'm going to turn it back over to Dr. Cusack, who will talk about some strategies.
Perfect. So Mike asked, I'm not sure if it was on behalf of somebody during Pat's talk, for Anglophone providers, what can we do? And this is the whole point of our talk. This is perfect. This is why we're here, is everybody can do something. And the first step is recognizing that there is a deficit in care. And the second step is doing your best to do something about it. So number one, for the Francophones, please don't be scared to use your French. This is a recurring theme that I hear in my Northern Ontario Francophones saying, I don't want to use my French because it's rusty. I haven't used it since high school. What else have I heard? I'm not sure if the information that I provide is going to be correct. So medical, legally, it's safer if I just use English. I've heard it all. It all comes back to who is the most important person in the room. And it is the patient. And that is the take-home message out of this whole talk. So if you can provide even a few words, listen, I can't speak Italian, but when I have Italian patients, instead of asking, do you have pain here? I might say, dolore qui, dolore qui. I don't know much. They can answer yes or no. They clearly know that I'm not Italian. They're not going to answer with a soliloquy about their pain, but feel comforted. They feel better. They feel reassured that, hey, I care and I'm trying to accommodate their needs. So for the Francophones, if this is a university professor, I would encourage you to speak as high a level of French as possible, for example. But if this is, I always throw them under the bus, the farmer from Chalmasford, please don't use the highest level of French because they won't understand it anyways. And quite frankly, in Northern Ontario, the language of healthcare is English. So you're going to find most patients don't even understand the terms so even if you do knew them, they wouldn't be useful. If you want to speak to the typical Northern Ontarian, my experience has been as follows, and it is a mix of French and English. For example, I'll often go in and say, hello, bonjour, my name is Dr. Meghan Cusack. Est-ce que vous préférez en français or in English? And they'll say, oh, well, I do not want to speak in French. I don't want to not understand. And I'll say, okay, ben on peut parler la moitié en français and half in English, and we can speak en bon franco-ontarien. Anyways, we can just go back and forth selon ton confort. And they'll go, again, it's with the patient in the room. So that if I want to talk to them about their heart attack, I'm not going to talk to them about their infarctus du myocarde because they will have no idea what I'm talking about. We're going to talk, ben madame, tu as eu un heart attack. Puis ça se peut que ça va causer du heart failure. Ça se peut que ça va causer de la fibrillation auriculaire, which is atrial fibrillation. And then I'll explain what atrial fibrillation is, usually with my hands, talk about worm's egg or whatnot. This is about communication. This is not about a perfect level of French. This is about communication with the patient, making them more comfortable, more apt to ask their questions, more apt to let you know if they don't understand. This is what this is all about. Now, let's say you are a francophile, hit and miss. You want to make sure you're sensitive to patients' needs, but you don't really feel comfortable providing all the care in French or even limited care in French. How about asking for an interpreter? We have them in the hospital. How about asking for a professional colleague that can come in and translate for them? That is hugely useful and is a hugely underutilized service in our hospital at HSN. I've seen it time and time again. There is a Francophone nurse right there, but the Anglophone physician has not utilized the services and is just going ahead in English to the very, very Francophone patient. The services are there. We can use our colleagues. Of course, a professional interpreter is the best. Sometimes that's a limited resource. So at the very least, a professional colleague would be the next best choice. If that fails, then family members acceptable. It's not the ideal. You don't want to be talking about a patient's possible sexually transmitted infection with their son being the interpreter. But again, depending on the situation, it sometimes is the necessary evil. But use interpretation. Ask them, do you want to speak? Do you want to have an interpreter? Would you like me to try to arrange for that in advance of the appointment? Do you know that they're Francophone? Make sure that they have that family member there. Be that second set of ears, so that you can make sure that they're understanding. And again, if you think this isn't happening in Sudbury, I assure you it is. I had a patient who was about 85 years old-ish. Let's call him Monsieur Tranchemontagne. It's my Francophone name, of course. And he was in the hospital for an unrelated cardiac issue. Ended up having a bit of heart failure. But while he was there, the nurses were putting a catheter in, and they found that he had phimosis, meaning the foreskin of his penis was kind of scarred down. They were having a hard time getting it back. So the family physician was actually a good colleague of mine, lovely gentleman, very efficient, very capable, but Anglophone. Spoke to the urologist and said, I think he might need an intervention. Urologist said, yeah, I think he's going to need a circumcision. Urologist then referred to his colleague, also Anglophone, because he's the one that had the next OR time. And the general surgeon went in and did a circumcision. Now, I happen to know that in our healthcare system, no procedure is done without a patient signing a consent form. So I know that happened because that's the standard of care. He came in to see me 2 weeks after, as per the usual, and I had all the reports. And I said, "Okay, Mr. Tranchemontagne, I'm aware of your stay and how you're feeling with your cardiac health. Great. You're healing okay. Great, perfect." I said, "Do you have any questions for me?" He said, "Oh, I just have one." I said, "What's that?" He says, "Is it going to grow back?" I was a little shocked. I said, I'm sorry, sir. I said, "You had a circumcision. It actually removed the foreskin. It's not going to be growing back." He said, "Oh, okay. Well, how do I protect it then?" And let me tell you, I've never wanted to knit a little toque as much as I did that day. But he had no idea what had happened to him, had no idea what to expect, had no idea how to go forward with care, because he's too embarrassed to admit that he didn't understand the instructions from the physician. So he signed away that consent form, having no idea what was going on. And that happens every single day, because especially my elderly Francophone men, they cannot admit that they don't understand. So it is there's a reason that we call this active offer. You got to go in and make sure that they are understanding, asking about feedback. Did you understand? Can you repeat that back to me? Making sure that that is there. I'm just looking at some questions from Mike here. Do you have any thoughts on using technology like Google Translate? Listen, it is a great resource. I have used it with a Polish patient. It does make for some stilted conversation, but it's sure as heck better than nothing. Again, there's a hierarchy of tools here, and at the end of the day, anything is better than nothing, right? So learn French, great. It's a great number one. Not really reasonable for everybody to have it, but a great number one. Number two, use a professional colleague. Number three, use a family member. Number four, Google Translate is great. Number five, if that's not even available, at least try to have access to some Francophone handouts. There is a hierarchy of care, but if you care and you are trying, then you will do a heck of a lot better than we're doing now. And do you have any suggestions on what the rehab services program at NOSM could be doing to help with recruitment of Francophone rehab professionals? Number one, letting them know that we're looking for Francophone professionals, making sure that the Francophones have access to training. That's the one big thing that NOSM didn't have, is they're coming in and then being out of the system, having no access to training in French. They did not feel competent providing care to Francophone patients. So that's why we initiated, that's why myself as clinical Francophone lead, along with Rodrigue, we started off with simulated clinical sessions. We would pretend to do a case where there was a Francophone patient and the students would practice. Then the students indicated that they didn't understand the terminology. They wanted to review terminology. So I quite happily started some terminology sessions on Fridays at noon every once in a while. So then they felt more competent from that perspective. And I have to be honest, the feedback over the past few years is significantly better. These students are coming out feeling at least somewhat more prepared. And I think they're actually starting to provide care in French to Francophone patients. The only other thing that I want to say is, even for my fantastic Anglophone colleagues, you guys are great. I want to make sure that you're part of the conversation, and I want to show you what insensitivity can lead to with one last example, because this was very recent. A patient of mine had a medical student that I think was a little on the fence about his passion about providing care to Francophones, even though he was a Francophone student. So I lobbed him in with all the Francophone patients to make sure he was comfortable at the end. And he came out looking shell-shocked. And I said, well, what happened? And I went back in and they explained the situation. So my patient, middle-aged, bordering on elderly gentleman, has a cancer, rectal cancer, actually. He's going to need a colostomy. It already has metastasized with stage 4, gone into the lymph nodes, fairly extensive local extension. And the fantastic oncologist was speaking to the patient's nurse, patient's wife, who happened to be a nurse, and they were speaking medical speak. So your husband has a stage 4 squamous cell carcinoma of the anal rectal verge. We're going to be looking at, cisplatin chemotherapy followed by radiation therapy. He'll likely need a colostomy tube, blah, 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 blah. The wife finally said, sweetie, are you understanding what she's saying? And he's fluently bilingual, let's be very clear. A little bit of an accent, maybe at most. And he said, not really. And she said, well, say something. So the husband looked at the oncologist and said, I'm sorry, a little self-effacing, typical patient. He says, I'm sorry, can you speak my language? She says, oh, sir, I'm sorry, I don't speak French. And then continued to speak medical speak to the wife. He told my medical student at the most vulnerable, scared time of his life, he had never felt so small. He had never felt like such dirt on the floor as he did in that moment. This is not about making everybody Francophones, guys. This is about making sure that no patient who happens to be Francophone feels like less going through our system because we can't be bothered to figure out how to communicate better with them. That's what we're here for. Are there any questions at the end here? And I'm going to ask Pat to open up the mic. We can go through and answer them together. When it comes to medical legal concerns from Brock, I'm not sure. So I'm going to ask my colleagues for some help to answer the medical legal implications of other specialties.
If I could, and if anyone has a better idea of the HIPAA, but at no point are we saying that you do not get the patient's consent first. You would say if there is that conversation, if there's a challenge with communication, you will ask the patient and say, I have a colleague who can speak French or Italian or what have you. Would you mind if I go get them? So it's the patient's choice at that point. And I'd be surprised if there's patients that would say no or would rather continue with a poor communication, which will have other medical legal implications if you do make a mistake. So I don't know what the letter of the law for HIPAA would be, but I know that we're absolutely not saying that you would do it without the patient's consent.
Perfect. Any other questions from anybody? Comments? I mean, has anybody else seen these inequalities with regards to linguistic or cultural challenges in their practice? Oh, Pat, I think that means that everybody's a convert.
That's great. So we did our job good then.
Hi, Dr. Cusack. It's Suzanne. I just want to comment that, I do often offer I call it Ontario bilingualism because it is half French, half English, and it usually works quite nicely. Often I do get a request for them to get a English handout because they're afraid that it's going to be like Parisian, I'm a dietitian, so it's food related, right? So I remember having like a agree to disagree conversation with an excellent translator at the hospital, but she wanted to put pastèque for melon d'eau so I mean, I know that's right. I know it's the good sorry, my dog just came in here. Anyways, and so I know that we have to kind of give and take and not be afraid of not being perfect. I find I am losing my French because I don't speak it a lot with my craft. I try to speak it at home with hubby and kids and that. But I got to admit, I don't listen to French TV and radio and stuff, which I should. In regards to the French language service training that we have available through home care, it's a 5-hour training. So I've been moving it from Friday to the next Friday to the next Friday, like probably for months right now, because I just can't spare the 5 hours. So anyways, no excuse, but I appreciate this presentation and any offerings and things that I can tap into, perhaps in January. I think there was a thing I saw in the chat. And so I'm very grateful and thank you for your time.
Perfect. Thank you so much. And Pat, I think you had a few slides at the end with some resources. Am I right?
Yeah, so that's actually, thank you, Susan, because that is a perfect link to the last couple slides that I wanted to share. So we'll just go back to my presentation. And And this is
if I could interrupt just quickly, there was another question that came in.
Sure.
Yeah, it's in the chat.
Yeah,
I'm not sure what AXing means. Axing, a street people is Francophones.
Assessing.
Oh, assessing. Oh, I'm sorry.
Yeah.
Standardized in Quebec, you might have to, well, you might have to do what most of us Francophones have unfortunately learned how to do on the fly, which is access to both and do the flip back and forth depending on where their comfort level lies. It's not ideal. It's not great. But in terms of the standardized tools, you're probably going to get fair understanding, comprehension from the Quebec tools. When they get the blank look on their face going, I don't know what you're talking about when you talk about pastèque, you can say, okay, well, let's say that one in English. Most Francophones do have a working knowledge of English. So it is, if you can listen to Francophones speak to each other, it is almost a guarantee that there is going to be English words thrown in there left, right, and center. So I would say use the standardized tools from Quebec, but feel very, very comfortable, and I strongly recommend throwing in those English words whenever and making sure that the patients are very, very aware that you are happy to accommodate their comfort level. And if they don't understand, to just lift up a finger or whatever, make it really comfortable for them to interrupt and say, I don't know what that one is. And, you can make it self-deprecating. That's what I typically do is I'll say, look, I don't expect everybody to know what the means. I'll say, my grandma used to call slippers des pichous. So, we all say j'ai mal au coeur, meaning I'm nauseous. We are a confusing breed. So if there is some confusion, just welcome the interruption, and I suspect you'll get the best outcome that way.
Yeah, and if I could add one thing to that, there's an excellent speech language pathology program in French at Laurentian, and I know that they are very heavily involved in research, and that they do a lot of re-standardizing tools. Now, it might not be the tool you're looking for. I know a lot of things are done with children with them, but there is a lot of tools that are available that maybe are not readily available, but if you know the right people, you might be able to get something that's been standardized in Ontario. So if you have any questions or if you'd like to get in contact with any of those people, then shoot us an email and I'll try and find the right people for you to speak to. And with that, I just want to, well, you know what, we have a minute left. And really what I was going to show you is a prelude to the session that you will be having in January, I believe, anyway. So I think it's okay if we don't look at those tools because you'll be getting a whole session on those tools.
That's right. Thank you so much. We will be having that active offer webinar in January, and just wanted to thank both of you for this wonderful session. If I have any regrets, is that more people didn't attend, and that we weren't able to get this message out to more people. But we'll certainly promote the recording and encourage all of our learners coming to the North as well to watch it and to attend the January webinar and active offer as well. And I really want to say that an anecdote that you provided at the beginning, Megan, about an Anglophone kind of putting him or herself into the shoes of a Francophone and kind of experiencing a health crisis in a French-speaking country. I think that was a brilliant way to start this because it really forces you to think about what would it actually feel like if this was happening to me. So that was really powerful, and I think speaks to the importance of being able to help fill these cracks as best we can. So thank you very much. Danielle, I don't know if you wanted to say anything.
Hi, everyone. Danielle Barbeau-Rodrigue. I'm the Director of Francophone Affairs at NOSM. So I can put my email address actually in the chat, and I'll do that. And if ever there's anything that my office can provide. If you have other questions for Patrick or Megan, definitely you can, shoot me an email and I can forward that information on, or any request for information on. I would be more than happy to do so. And if my office can be of any assistance in whatever capacity, for sure, please feel free to connect with me, and I'll be happy to do what I can to be of assistance. So I'm just putting my email in just now. And thanks so much for attending.
Great. Thank you, Daniel, and have a great night, everyone.
Thank you.